Doctor, can you tell us whether carpal tunnel release can be done as an outpatient? Yes, it can be. Almost all carpal tunnel releases are performed in an outpatient setting. Do I need, doctor, a general anesthetic? Well, many people are able to have the operation under local anesthesia or light sedation, but general anesthesia also is an option. Doctor, what special tests are needed? X-rays of the wrist may be indicated if you have limited wrist movements or previous fracture. Nerve conduction studies can confirm the diagnosis by demonstrating a slower than normal speed of conduction within the median nerve. Doctor, is there an ultrasound or magnetic resonance imaging done? No. It is sometimes used, however, to evaluate the soft tissues in the carpal tunnel. Doctor, how long does the surgery take? It usually takes between 15 to 20 minutes. More complicated cases can take up to an hour or more. What is the mortality rate, doctor? Less than 0.25% or 1 in 4,000. Doctor, how long will I be in the hospital? Surgery is usually performed within 1 day on an outpatient basis. How many are performed in the U.S. each year? Around 580,000 operations are performed in the U.S. each year, with 3 times more women requiring surgery than males. Doctor, what is the testing for carpal tunnel syndrome? Well, doctors may perform a few clinical tests if they suspect CTS. And Phelan's maneuver involves what? It involves the gently flexing wrists by placing the hands back to back and holding them there for 60 seconds to see if this brings on symptomatology. Doctor, eliciting Tinel's sign involves tapping lightly over the median nerve at the creases in the wrist to see if this causes tingling or pins and needles. Is that correct? Well, I would say that Durkin's test involves applying firm pressure over the carpal tunnel for 30 seconds to see if this brings on symptoms. And asking you to try to straighten your thumb means what? Well, if you straighten your thumb against resistance, the check for weakness of the median nerve is evident. Doctor, touching your fingertips with a pin checks whether or not you can distinguish between 1 and 2 pinpoints held close together with your eyes closed. Is that not correct? Yes, that is correct. And may this lead to inflammation? No, but swelling of tissues around the sheaths, that is, peritendinitis and tenosynovitis, to put pressure on the median nerve, means that another explanation is that repetitive movement affects the muscles and nerve endings in the hand and forearm to cause pain of a biomechanical nature rather than through a true carpal tunnel syndrome. This is a controversial area as it can affect entitlement to time off work and financial compensation. Doctor, the open carpal tunnel release is the most commonly performed operation for CTS, is it not? Well, although an endoscopic surgical technique is available for that, and open surgery provides better visualization of the median nerve and is preferred by many hand surgeons because of the reduced risk of median nerve damage. Doctor, it may also allow the surgeon to divide the outermost layer of tissue surrounding the nerve, that is the epineurium, if necessary, to free a tightly trapped nerve? Yes, in a procedure called epineurolysis. In an epineurolysis, it also allows him or her to remove any excess tissue surrounding the flexor tendons in a procedure called flexor tenosynovectomy. And this is needed if symptoms are linked with swelling or a buildup of scar tissue. Doctor, as carpal tunnel release is usually carried out under local anesthetic, you will remain awake, will you not? Yes, the patient throughout the short operation is sedated and may be offered the means by which it is likely that he will remember little of the procedure afterward. Doctor, is there a local anesthesia for carpal tunnel release? Yes, the hand and wrist can be numbed in several ways.
How do you write numbed?
I write it with an asterisk, numb. See, there's an alternate short form, but the alternate short form is not helpful either. That's nub. So what good is nub? So that's the word nub. So you might as well have nub. Now, with respect to that, to give you a more sophisticated idea, I'm trying to adopt, when they say number 3, number 4, I want capital NO period 3, capital NO period 4. That's number 1 in the